All right, y'all. Hello and welcome to the April 2025 meeting of the DuPage ROSC Council. My name is Jared Burton. I am, as always, your ROSC coordinator. Could we start by asking that everyone online, please make sure your mics are muted so that we can avoid any interruptions. That would be great. If you have not yet put your name and contact info into the chat, if you wouldn't mind doing that, that'd be great for us to take attendance. And then if you're here in person, we'll have a little sign-in sheet at the end just so we can log that you were here. I'd like to start today, as I often do, with kind of like an anecdote and then an icebreaker question related to that anecdote. So yesterday, my team and I, meaning like the core kind of ROSC team, went down to Bloomington Normal for the quarterly in-person statewide ROSC meeting. We meet monthly, but it's usually only quarterly that all the ROSC from across the state get a chance to convene and kind of learn from each other, get some educations and trainings, and find out what all of these ROSCs are doing across the state of Illinois. We love being able to attend these. It really does give us an opportunity to get in the other room or get in a room with other ROSCs and hear about all the amazing work that's being done across the state. There were two really great presentations. One was on the topic of sustainability. And all I'll say on that is sustainability is super important to models like ours, but also anyone working in the nonprofit space. And it's not just money, right? It's not just about who's going to pay the bills, although that's like the number one concern. It's also about, succession. It's also about leaving in place programs that can continue in the community if a lead agency is no longer around. A whole lot of good stuff as it relates to our particular program. And in the next couple of months, we'll hopefully have some more information on some of those methods and some of those strategies for sustainability at this meeting. So that was a really good one. The second one was actually on how to more strategically use your story when going out to do this work. And when I say your story, I mean those of us who have lived experience. So people that are in recovery ourselves, or maybe we're a family member of someone who's been living with substance use challenges. We all have a story, right? And we all want to be able to use our story. And sometimes there's even more effective ways that we can do that based on the types of outreach that we're doing. So really inspiring, longer sessions, learned a lot. We're going to bring a lot of that back here. But the even more inspiring part is, like I said, getting to meet Ross from the middle of the state or getting to meet Ross from downstate, communities that look, sometimes quite different from ours in terms of demographics, but people who are dealing in their counties with the exact same problems here in DuPage and the surrounding counties with substance use and mental health challenges. So, I talked to multiple Ross who would come up and ask about some of the projects we've been working on, like the Narcan boxes or how to duplicate like the WhatsApp model that we've done. But then I'm also asking them questions about some of the way like they've engaged certain sectors, because there's Ross who are downstate who maybe have no issue getting folks from like first responders or some churches or other places that traditionally it's been tough for us to get people coming back month after month. So it was a lot of two-way learning, us learning from what those Ross are doing, and then hopefully we're able to give them a little bit about what we've been doing up here. But long story short, like we left that session yesterday feeling super inspired to come back and do this work, to continue doing this work at a high level, and try to provide the people of DuPage County, an overall better picture of wellness and truly continue to build this culture of recovery. So having been so inspired, I thought a good icebreaker for today would to ask people, what is their inspiration? And that could be something that's personal or professional, but what is it that like makes you get out of bed, like wanting to come to work, or, getting off work and going out to do outreach work in the community? I would really like to learn what inspires other people. So, I would love to hear from at least a few of you. We don't have to do all of us because there's quite a few people here. But if a couple of people want to volunteer to tell us what inspires them, I would love that. So if you're online, you want to share with us, you can raise your digital hand and we'll try to get you up here. Or if you're in person and you want to share what inspires you, you can just raise your regular hand and we'll get the game show microphone around to you. So not everybody at once. There's too many people raising their hands here. Okay, we got a couple. Jordan Esser, my colleague from PLT. What inspires you, Jordan?
Hi, everybody. Jordan Esser, DuPage County Health Department and Prevention Leadership Team. Without getting too political, the political landscape motivates me really a lot these days to get out of bed. I feel very fortunate that I'm in a position to make change, try to make things better for people that are being impacted right now. And I think we're all being impacted on some point. And then obviously just my kids. My kids have made everything, the world look different for me. So I think this work is really contributing to that and hopefully making things a little easier and better for them as they get older.
Awesome. Thank you, Jory. I got one in the chat that says, knowing that miracle of recovery is real and can happen to everyone. I never know who it'll happen for and when. That's a really good one from our friend John at CDH Hospital. I'm really struggling to believe that none of you, 30 people on here. Okay, we got Judith, our friend from the coroner's office. Judith, what inspires you?
Thank you. The reason I ran actually for coroner is because I have lost two nephews to suicide and I lost one nephew to substance use. And I'm a registered nurse. And, as a nurse, I can only reach a very limited number of people. And when there's a tragedy or some kind of a major shift or a change in our life, that's where movements are born. And that's when people will write a book or they form Mothers Against Drunk Driving. So losing these, I have two sisters, and they each lost a son to suicide, and one of them also lost the one from substance use. And I kept thinking, how can I reach more people? What can I do? So that's actually what propelled me to run for coroner, because there's almost 1 million people in DuPage County. We have $970,000. And so I was 970,000 people, yeah, if we all had a dollar, right? So, I instead of we all tend to look at the problem when it become a problem, when it's kind of flaring and we need to know what can we do about that. And, I don't have to tell you, they've had the DARE program, Just Say No. And these programs, studies really have shown it really hasn't done much to change the problem. So the definition of insanity is doing things the same way every time and expecting different results. So I thought, how can I do something different? So instead of coming to the issue downstream, I want to go upstream and see if I can change things that way. So what I'm developing, and this is going to take like a year or two, well, it could probably take a couple of years to develop, and then I'm hoping it will continue to evolve. I want to create a program teaching. I'd love to teach everybody in the county, but I think initially I'm going to go to like middle school and high school kids, teaching them coping skills and things that don't require mom's taxi or money. And so this is what drives me because it's personal to me. And that's what brings me to work because I like I said, I couldn't help my nephews. No, nobody knew that they were going to take their lives. And so that's my driving motivator, and that's why I'm here. So thank you for having me.
Thank you, Judith, and thank you for being so supportive from the moment you've kind of gotten to the office. And yeah, we're thrilled to have you here every month. So thank you for that.
Thank you.
There was one more in the chat, and then we'll kind of get to some stuff in the content of the meeting. But our friend Nicole from RCA, who's actually going to be back to present for us in July, who says her kids and her brother and those who cannot advocate for themselves. Advocacy for those who can't is such a huge piece of what we do. So thank you to everybody who's doing that. And if you did not get a chance to talk about what inspires you and you think of something at the end, if we've got some time, I would love to hear it from you. So the other one little housekeeping thing before we start to promote some of the upcoming meetings and trainings and things like that is anyone here for their very, very first DuPage ROSC Council meeting ever? We do have one in person. We're gonna do the game show mic. We're gonna pass this around. Should be good. And once you get it, you can just talk right into it. Should be good.
Alrighty. I am Maddie Nave Tortelli. This is my first time today. I am a professor at North Central College and teach in the master's and doctorate programs for occupational therapists. But specifically, I'm teaching the mental health coursework. It's where my experience lies. It's my lived experience as well that drives me. And I'm just really trying to reform our education for OTs and make sure that it is driven by those of us in recovery.
That's awesome. We're so glad to have you here. And listen, as we'll get into when we start to promote some of these things, we're getting into Mental Health Awareness Month in May. Obviously, it's something we're always aware of, but we really want to make that push for people to be aware of what services are available and how people can better access those services and increase equity across the community. There was a few people. Looks like Karen has her hand up. Karen, is this your first meeting?
Yes, it is. Yeah, I'm a CRSS student at College of DuPage, and attending these meetings is an assignment, but I'm also here to learn. And Bruce, one of my teachers, is a big advocate for this agency. And so, yeah, so that's several reasons why I'm here, but yeah, it's my first time. Thank you.
Great. Glad to have you here. We love students. I think there's a few more too. I know Chris from Hesed House is here for his first one. Looks like Stephanie Snow. We got an Alicia. We got a Camille. We love students. We love Bruce's students. And so if you're a student, even though it's an assignment, come see us because we love to have you here with us as we get more and more peer support workers deployed in our area. It's always a need. So I'm going to ask my assistant, Danny, my assistant for today's meeting, to come up and help me by running some visuals because AV problems on this computer is just a fact of life. So Danny's going to pull up a few things about today and we'll go through some of them. So for those of you who are here for your very first ROSC meeting, Bruce may have described a little bit about it. You may have been in one of the classes that Danny and I actually went out recently and spoke to. If you're unaware of what a ROSC is or what DuPage ROSC does, it's a coordinated effort of people and organizations that kind of work along the recovery continuum and recovery from substance use and mental health challenges. We try to center the voices of people with lived experience because there should be nothing about us without us, meaning people who are in recovery, people with lived experience with family members. Those are the types of voices we want to center for programs like this. And we seek to identify and then work to really try to smash barriers down so there can be an improving the equity of services here in DuPage County. So that's kind of what a ROSC is and what DuPage ROSC does. It's way deeper than that, but that's the Cliffs Notes version. So you can go to the next one, Danny. So for today's meeting, we're about to run through a bunch of these upcoming things to promote. Danny is going to give just a brief rundown on his CORS grant update, which is the program that he coordinates throughout this county and a bunch of other surrounding counties. I'm going to give a very, very quick update on the WhatsApp because Blake unfortunately can't make it, so I've got the shortened version of that. Then we have our friend Kylie from Geode Health. Glad to have her rescheduled from a few months back, so we're glad to have her here with us. And then Neesha Stringfellow, who's our good friend and the executive director at HLM Recovery 180, which does the ROSC work in Will and Grundy counties. So glad to have everybody here. At the end, if we've got time and you've got an update you would like to promote, we'll leave that time for you. So you can go to the next one. The next council meeting is actually going to be on Wednesday, May 14th at 3 p.m. It's always on the second Wednesday of every month. The Zoom always stays the same. So if you've got this month's Zoom information, just keep it. It stays the same every month. To celebrate National Mental Health Awareness Month, we've got presentations from NAMI DuPage plus Blue Kite Wellness. So two organizations that are doing a ton of work on that mental health continuum. So important to spotlight those services. As always, that you could attend these meetings as a hybrid, so either on Zoom or in person here at Serenity House. One thing I do want to bring up, and I'll send this out in a follow-up email. One goal we'd like to have for the ROSC in this year is to start to host some of these council meetings, maybe at different sites throughout DuPage. So for partner sites, if you might be somebody who'd be interested in hosting one of these ROSC council meetings, we would love to chat with you about that because it'd be important for us to kind of get back out into the community a little bit more, kind of host some of these meetings from there. DuPage ROSC presentation series. This is something that we do on the third Wednesday of every month at 10 a.m. These are only on Zoom. And this gives us an opportunity to kind of dig deeper into a topic for a little bit longer too. And we have presentations at this meeting. They usually cap at about 10 to 15 minutes. These presentations are more like 45 to an hour. We always try to pick a topic on the recovery continuum that's either timely or maybe it's something that maybe a whole lot of people haven't heard about yet or or trends that are happening. This actual presentation is one I did over a year ago, and I brought it up a couple of times because the recording of that meeting got corrupted. So this is one of those like lost presentations. But I've had a handful of people ask me if I was going to be doing this one again. So yes, this is going to be an updated, a very highly updated version of a similar presentation I did last year. So these are open to the public. Come join us. We're going to talk about all of the, as my colleague Blake likes to call them, gray market items that you can buy inside a vape shop that isn't just vapes. So hope you can join us at that April 16th at 10 a.m. You heard from Jory earlier on what inspires her. Well, they inspire me because we are doing a Help Teens Have a Summer to Remember event next Tuesday at the Addison Township offices over on 401 North Addison Road in Addison. This is a really, really great event for parents and caregivers, people who have, teen children who are maybe hitting that age where they're starting to experiment with things, substances and vaping and all the other things that teenagers get into. So this is actually going to be a way for them to hear about current and emerging trends that we're seeing, the impacts of alcohol, tobacco, and marijuana use, how to approach your teens, how to talk to your teens about these things. And there will be some resource tables there too. So we would love to have you. That is next Tuesday from 7 to 8:30 p.m. Yeah, all are welcome. Danielle, do you want to promote this one since you're right in front of me and I can pass you the mic?
Hey everybody. Let me go to the camera. Hi everybody. Are we good? So every Wednesday, from 1 p.m. to 2 p.m., I just got back from it. We have a smart recovery meeting that we host at Stony Brook Center. Stony Brook Center isn't too far from Serenity House. It's about maybe like 15 minutes southwest of us. So it's not too far, right on Roosevelt Road in Wheaton. It's a really good meeting. We've been having really good meetings lately with quite a few people coming to it. So yeah, it's a great smart recovery meeting. We would love to have you, or if you want to promote it with any clients that you have, we would love for them to come check it out. Thanks.
All right, now throwing it over to my colleague Danny to talk about the Coors Grant update. I'll just give you my mic.
Thank you, sir. Good afternoon, everyone. Danny Sorbis. I coordinate the Community Outreach Recovery Support Grant. Our priority populations are those who are unhoused or risk of being unhoused, have substance use or opioid use disorder and other mental health challenges that go along with it, and those at risk of medical complications, overdose, and incarceration. So as Jared said, we work in several surrounding counties, including Will, Grundy, Kankakee, Kane, McHenry, so on and so forth, and of course DuPage. We do harm reduction, training, education, distribution. We provide coaching services. We connect with referrals. I know Jared will talk about the WhatsApp referral hub that started with the ROSC, which we also utilize. And yeah, that's just us in a nutshell. We would love to help you out. I'll put my email in the chat. So if anybody has any more questions, please feel free to reach out. I will also share a couple of the hybrid meetings that we have. Well, they're hybrid now. In the past, for the past few months, we've had virtual SMART and Refuge meetings held on Saturday mornings, but starting this past Saturday, we now have them hybrid here at Serenity House and still online for those in those farther counties that want to get support. Or even have people from Texas actually join, so that's kind of fun. So the hybrid SMART meeting is Saturday mornings from 9 a.m. to 10 a.m. And then our hybrid refuge meetings are from 10:30 a.m. to 11:30 a.m. Again, I'll put my email in the chat if you have any questions. Otherwise, hope to see you there.
All right. Thank you, Danny. And you can actually stop your share at this point because we're very shortly going to get into our first couple of presenters. But I did want to put up an update. Many of you are part of our WhatsApp referral hub. If you're unaware of what it is, I'll give you the real quick rundown. A few years ago, a bunch of us who worked in the field, who's kind of were people who are working with like a lot of timely and quick referrals that were necessary. And so we've realized that that's not always an easy thing to do when you don't know what's out there. And so a bunch of us joined a group text where we helped each other specifically with referrals that has now grown to need to be on WhatsApp just because we can't take care of it on different carriers on a text. So we are up to this month 146 members on the WhatsApp, which is just insane. That's people across not only Northern Illinois, but it also extending down into Central Illinois. It's people who work in all different sectors on the recovery continuum who are available to help with referrals. So if you're somebody who works for an organization where, you're doing stuff with aftercare for clients, or you're seeking, folks who are looking for residential treatment, detox beds, I mean, really anything you could think of, it is free to join, really easy to use, and we do a lot of referrals on there. So 146 members, added 9 new members this month, and we provided a whopping 55 referrals this month, which is pretty crazy. Thank you everybody who takes part in that. The winner of this month's Referral Hub MVP with 7 referrals made, it's our friend and one of today's very special guests, Neesha Stringfellow. Neesha, congratulations. You give her a round of applause, folks. I believe she did 8 referrals made this month. So Neesha, thank you so much for the work that you do and the work that everybody does on that WhatsApp. I mean, it's truly selfless. The people who are helping each other out on that is pretty amazing. So Neesha, you're the proud winner of a gift card, which I'll be sending out to you in the next week. So thank you for all that you do, Neesha. Now, with all of that stuff out of the way, it is time to get to our first guest, and that's our friend Kylie from Geode Health. So as I said, as we move closer to Mental Health Awareness Month, it is always good to spotlight organizations and programs that are providing wide ranges of services for people who are living with mental health and substance use challenges. As I said earlier, Geode was originally going to join us a couple months back, but we're glad we could reschedule and have Kylie Sanko with us, who is the community outreach manager at Geode and somebody who has been coming to our meetings and engaging with us and taking part in our events for a couple of years now. So we're glad to have her with us, glad to have her as a member of the DuPage ROSC. So she's here to talk to us about all the work they do over at Geode. And so Kylie, I'm going to turn it over to you. I can make you a co-host and we'll go from there. So hang on one second.
Sure. I feel like Neesha needs to go before me now. Now that she won the award, she's got to give her speech.
I know. All right, let's see here. If I can find you on the list. There you are. Okay. And you are now co-host, so
Good.
share
Okay.
away.
Let's see. Let's see if this works. Oh, that's my dog. Do you see this?
Yes, we got it.
Cool. Well, hi everybody. Yeah, thanks for the intro. So my name is Kylie Sanko. I do community outreach for Geode Health. I'm sure I've probably talked to some of you guys in our WhatsApp group message, but I'm just going to share a little bit about Geode. So currently we have about 19 locations in the Chicagoland. I guess I could maybe start with that those are all down here. So all of our locations, we can serve people virtually or in person. We have quite a few. We recently expanded up into Wisconsin, and then we have some kind of up near there in like the Libertyville area. We have some more in DuPage. We recently expanded down to like the Joliet area. So, and then we have a few in the city too, as you can see here. So we're pretty kind of scattered throughout the Chicagoland. Like I said, all of our services can be virtual or can be in person. And then I will go up to some of our services up here. So overall, we offer outpatient mental health care. So we can do therapy, psychiatry, medication management, medication assisted treatment, and then at a few of our offices, we can do TMS and Spravato. So the cool thing about that is all of our offices offer the same thing. So that can be really helpful for patients when they're coming in, that they can just seek all of the same services out of the same office. That was a big reason that we were created, honestly, was because we were finding that folks were going to like here and here and here and all these different areas. And so it's just helpful sometimes, just that patients can kind of seek all of their appointments in one setting. And then with that too, a lot of our providers, they work together, right? As long as the ROI is signed, it can kind of be helpful that your therapist and psychiatrist can talk too. So So those are a little bit about our services. We can see as young as 5, really all the way up into the lifespan. Let's see, we have couples therapy, we have family therapy, different diagnosis, just kind of depends on the office. So we have quite a few CADCs and folks that can just specialize in SUD. We have neurodivergent, we have some eating disorder, depression, anxiety, so kind of just all over the board. When it gets into those more specifics, you can always just shoot me an email if you ever have questions, and I can get it checked on our end. But that's a little bit about our services. Here is our insurance. Insurance accepted. So we can do HMOs, handful of HMOs. We can do PPOs, as well as Medicare and Medicare Advantage. So the only one we do not, which if you do, please let me know, is Medicaid. We look to refer out for that quite often. That's probably just the one that I would say we don't do. But all the other ones we are in network with. Down here just kind of goes over a little bit more about some of our services. I should have mentioned too, we can schedule same week appointments for any of our offices, any of our services as well. And that also goes for virtual or for in-person. And then down here is just some of our referral information. So you're always more than welcome to message me. I put it in the chat. But I work really closely with our providers. So when our providers need, all the above of everything, I feel like we were always in constant need of, like, support groups are a really big one for us. Psych testing is a really big one. IOP, PHP, detox, residential, inpatient, right? Like, we are only serving one area. And so we're really big into just learning about our community partners. So I would love to meet with any of you that can offer some services. And then I will always pass it along to our providers, but I help them refer out. So that's
Real
a little
quick,
bit about us. Yeah.
Can you, for those people who maybe aren't aware of what it is, or maybe have heard about it but aren't sure, what Spravato is,
Oh boy, you're
and
putting me
kind
on the
of
spot.
what is speech? Well, I mean, it's esketamine, right?
It is,
That's kind of
yes.
the
Yeah, it is
medical
man.
term for it. Yeah.
Yes, it can go deep. I have to be very honest. I probably know this much of it, but it is.
Well, just
Yes,
give
Spravato,
us that much then.
yes, is a esketamine nasal spray. So it is for your treatment resistant depression. So it's for the folks that have tried, a variety of antidepressants, a variety of IOP and PHP and residential, and it just feels like nothing is working. That's when we would look at Spravato. It's pretty, it's very non-invasive, but it's very intense. So it's definitely not something that, we would say is for everybody. But it's definitely for the folks that you have just learned, hey, I just, I don't know, nothing seems to help.
Yeah, it's one of those that we've been hearing about for like a few years, and I think the issue with it for some folks was that it might have even been like cost prohibitive, or especially like when it first started hitting in our area, like it was either cost prohibitive, or there was certain insurances that just immediately would disqualify it. But I think the good thing is that more and more insurances are accepting it now, because now this is like my opinion, but it's also anecdotal. But some of the people who need like alternative treatments, or like treatments for resistant, depression that's resistant like that, are some folks who maybe aren't able to pay for some of those types of things. So the fact that, like, it's starting to open up more for like Medicaid and others, hopefully Medicare someday,
Yeah.
it is really, good to see. And it's one of those things that we love to learn more about. So glad that that's something that y'all are offering. The other question is real quick, and again, you don't have to know the list, but the MAT treatment, so the medication assisted treatment, is that just kind of like your Suboxones, Vivitrol? It's not methadone. I always have to ask MAT.
Correct. Yeah. No, I'm glad you asked. Yeah. So methadone, we would look to refer out to like a probably methadone specific clinic. But yeah, all the other ones we do: Vivitrol, Suboxone, Sublocade. I'm probably missing a ton. But again, if there's anyone specific, always feel free to just shoot me a text or an email and I can confirm. But for the most part, all of those, yeah. And that also goes for Medicare as well.
Are you seeing a lot of people use the telehealth option? That's the other question I asked a lot of providers lately, just to see, like, if you have like a ballpark, is it like 50-50, do you think? Or how many people are accessing the telehealth?
Yeah, well, this stat probably will not shock you, but most adolescents are telehealth, I would say. Most maybe older adults, I think, like to go in person. But really it kind of depends. We do a lot of hybrid. So like, hey, this week I can make it, right? This week I can't, things like that. But I have been pleasantly surprised by how many more people I think want to come in person. I think COVID gave us the option, right, to do virtual, and I think it's awesome at times, but I just think there's a specific part, right, of just like meeting in person, right? Even if it's not every session, that can really help, especially with a lot of the mental health things, right? Like loneliness, for example, or grief and loss. Sometimes it can just be helpful to just see somebody in person with that. So yeah. So I guess to answer your question, more of the younger folks like to do virtual.
Absolutely. Yeah, they definitely like the virtual option as
Yeah.
opposed to the in-person. We get that too. So
Totally.
if anybody, you did put your contact info in the chat, so if anybody wants to hit you up directly, that I
Sure.
always like to ask that too, because like I love intake numbers and stuff, but how many times have we sat on hold at an intake number? So the more I can get people's like direct contact, the better. So if you've got that in there and people can reach out to you, that's awesome.
Yeah, and I'm more than happy to connect you directly to our referrals team, whatever it is. But I agree with you. Sometimes if people just have a few questions or they want to, I'm more than happy to introduce you to any of our providers. I think sometimes that can just be a helpful, just like a warm handoff. So always feel free to reach out to me directly too.
And if you ever go to a spiritual care network meeting in our area, you will see Kylie.
You will.
Her and our friend Mike Wood and others have a really, really cool thing. And I always like to mention it because I won't. How about, do you want to give me like the short,
Sure.
what spiritual care
Yeah,
network
totally.
does?
Yeah, thanks. I should definitely put a plug in for that. So Mike Wood, yeah, I'm sure some of you guys know him too. We really started this coalition called Spiritual Care Network to really help bridge the gap between the mental health field, the substance use field, and churches. We just kind of felt that there was this need of when people go, right, when people are struggling, if you're really involved in your church, it's probably going to be one of the first places you go. And then it kind of stopped there. Whereas, people within the church just don't really know what to do with you. Like they have volunteers and they're awesome, but sometimes people need, more intense care. So that's a time that we come together. There's lunch served. We usually have a speaker. And then it's just networking. So if you would love to come, we would love to have you. If you have any contacts to churches or anything like that, we would love to invite them as well. So let me know if you do, and I can also add you to our email thread. We meet once a month.
Awesome. Thank you, Kylie. So glad to have you.
Yeah, thank you.
And this is a good segue because we were talking at the end there about Spiritual Care Network. Our next guest, who we love, has a background in ministry, so we're glad to have her here with us. And I'm talking about this month's WhatsApp Referral Hub MVP, Neesha Stringfellow. So I've known Neesha for probably 3 years now, if not a little bit longer. She's the executive director of HLM Recovery 180, which is the ROSC handling so much cool stuff out in Will and Grundy counties through their lead agency, Heart Life Ministries. So again, like I said, I've had the pleasure of knowing Neesha for a few years now. It's always great that when we're able to invite our friends who are in other counties doing ROSC work here to kind of tell us about the initiatives they've got, the community needs they see, because, Region 2 across Northern Illinois is not just a random region with lines drawn on it. Like, recovery doesn't begin or end at county boundaries. So to be able to invite our friends from Will and Grundy County here to talk about their ROSC is really, really cool. So, and I will say this too, Neesha also hosts a really cool podcast, and I was a guest at one point, if you want to go back and check out that episode. Anyways, I'll stop there. Neesha, I'm going to turn it over to you. If you want to share your screen, I've got Danny here too, in case anything happens with the share, we should be good to go. So Neesha Stringfellow, everybody.
Hey. Hi, everybody. Thank you so much, Jared. And okay, so I am so surprised about it's what I do. It's my jam. Just making the connections, which case in point is the ROSC. So happy Wednesday, everybody. And thank you so much for the invitation. I want to just say that Jared, Danny, and all the DuPage ROSC, and then shout out to Kylie because our connection really made a difference, but I didn't even make the connection with Michael Wood and all of that. So all of that, but Kylie, you got to get on the calendar for this year. I still have space. Just grateful for the connection of recovery. And so before I share my screen, I just want to say I am a wife, a mommy, a Grammy, and I wear many hats. Some cultures might say I'm a Jamaican. Okay, so that means you just do a little bit of everything. I am a retired hairstylist, which means that I have been in the people business for over 35 years. And I love building relationships and making connections. And since Jared brought up the our statewide ROSC meeting yesterday, I think in our breakout session, one of the things that I talk about, I wrote a book about relationships that drive me crazy, but God's love heals, because relationships matter. And because I am faith-based, I will say God's idea was relationships. He thought of it, right? So I think it's so amazing to talk about that. And I want to talk about it in the space of recovery. The reason I do, yes, I am the executive director of the Will Grundy County ROSC, and we are pretty, hey, Mike, and we are definitely boots on the ground with making connections and building relationships. So I'm gonna share my screen and we'll get into it. I'm gonna ask some questions, you guys, and you all could just go ahead and wait. First, I got to share the screen, Neesha. Hold on. See, this is where I get, and I'm one hand man today. Okay, share the screen. Yes? Success?
Success.
Oh, yes. Okay. Um, so, um, because I am a relationships person, I really appreciate and value DuPage. Actually, Jared was our tech director first before Ben. He was the one that was over us. And then Danny became our director of making sure our coach and making sure that we were functioning well as a ROS. So my relationship runs deep. And I always say that relationships should go beyond the four walls of your work or the four walls of the church or the four walls of recovery, whatever space you're in. Hopefully your relationship will go beyond that. So today I'm going to talk about the gift of relationships that are going to work through recovery. And if you see, I spelled relationships real, REAL, because to me this is a real industry we're in. This is a real life lived experience. Lived experience. And so it's important that first of all, we identify that, you know what, you're not just connecting people to just check something off the list or to get a job done. You are actually establishing relationships that will make a difference, not only in your community, but for a lifetime. I heard Judith talk about her why, and we talked a lot about sustainability and different things like that yesterday at our statewide collaborative. That's why everything seems to be so parallel. But one of the things, oops, I didn't start my timer. But one of the things that my why, I grew up on the south side of Chicago, and we were poor, and I had family members. My grandmother was mentally ill, bipolar, schizophrenia. A few of my aunts dealt with depression and bipolar. Family members who addicts. I recall being 13 years old, and the police brought my aunt to our house. She had woke up in the middle of the night, got a hold of some angel dust, if you all remember what that was, and it affected her health, mental health, and it was just really very traumatic growing up. So my lived experience is through family and family, okay? But I think that sometimes there's a gap there that needs to be, the bridge needs to be built, because sometimes people who are walking through their own lived experience may not really understand that their story will impact their recovery journey and others' recovery journeys. What do I mean by that? So everybody that shares a story, you draw people in. And I loved listening to Judith and her why. I lost my nephew in 2021 to suicide. He was 18 at Manuka High School. He has 5 sisters. He was the second to the oldest, and he would have been 21 now. He was a basketball team leader, and he was amazing. And devastation hit our family. Right, I share that story not because it's something I like to remember, but then it's a reminder of my why. Yes, we had the ROSC probably 6 months prior to his passing by dying by way of suicide, but guess what? It made my why even stronger and more impactful. So, what did I do? I said, I am determined to build a bridge with the young people. That's one of my whys, so that our legacy will not be died by the means of suicide or mental health or substance use disorder. And yes, he was using substance use as well. So what do I do? Provide environments that encourage relationship building. So shout out to Mike Wood with Spiritual Care Network. I came up with Show Up Recovery for a lot of the faith-based communities, but I try to invite spaces, even the virtual spaces, that will encourage us to build relationships. You know why? Because the importance of trust and the building of supportive relationships is what's going to be substantial in us making a difference and making change. So, connecting for change, the power of relationship and recovery. So, first of all, and sorry about I'm working with a one hand. I have a cast on the other hand, so forgive my PowerPoint. But we have to be real. We have to be honest. We have to be ourselves. And a lot of times there's such a space of people superficialism sometimes, or shame, or things that grab people to withdraw and not really to be able to make that connection, or the color of their skin. Okay, I'm in counties that everybody doesn't look very brown. Okay, so but it does make a difference. People, diversity, inclusion, all of those things make a difference. So be honest, be real with people, and be yourself. Recovery starts with showing up as your full self. When you're real, you create space for others to be real. And so that's where the healing can happen. Diverse relationships, new perspective. Listen, be a listener of what's going on in other people's world and not just what's in your world. Because sometimes we can get so caught up in what we have going on that we miss the very moment of a connection that could have taken place, that could have changed someone's life. So surround yourself with people from different backgrounds that help see things in a different way. My pastor says this. Used to say it. He said, we'd like a little more coffee in this cream over here. I have a white pastor, so he's like, we like a little more coffee in this cream. Well, now they're saying we need a little more cream in this coffee because the neighborhoods have changed. But he said, who do you have lunch with every day? So that diversity in relationships makes a world of difference. You know why? Because it gives you access and support and ideas that you may not have had, and ideas that you may not have had on your own. Connection breaks cycles, okay? Isolation fuels shame and silence, especially around mental health and substance use. When people are alone, I hate that my nephew felt so alone. I deal with that, and it really does affect me sometimes, but the shame, the silence of what he was walking through, we cannot allow others to feel alone. When we connect with others, we build community that allows real change to take place. So, beyond the stigma, cultivating those connections in the recovery journey, what do we need to do? First of all, we have to identify that there are harmful effects of stigma, and that's a big thing that I've paid attention to. I have two pictures here, and the picture at the bottom is my little house I grew up in on the south side of Chicago. And there was a lot of stigma in this neighborhood, okay? My mother did not allow us to go to church, go outside, because we were very sheltered, because right next door was a drug house. And so it was definitely said that we would grow up and we would walk through addiction and all of those things. I have there's 8 of us all together that grew up in this house. And so, but you know what? Because there were connections and my mom was determined to make sure that we made connection with people of healthiness, guess what happened? The stigma was broken. Okay. What are you doing in your space and in your world to cause that stigma to be broken? And you have to go outside of your regular everyday neighborhood to do that. You have to create a stigma-free environment. And if you don't do it, it'll remain. Your story is going to make a difference. Okay. We have to be intentional about sharing. And don't be ashamed because you may not have ever used substance use, right? Okay, because sometimes people say, if you never had cancer, you'll never know what cancer feels like. You're absolutely right. But it doesn't mean my mom may not have walked through it. You understand what I'm saying? So I may have to connect on that base. But don't be so judgmental. You know what I mean? And sometimes we are very judgmental on the side of turning your nose up at people who walking through recovery, or those who walk through recovery and have lived experience may look like you've never been through it, so you can't identify with me, right? We have to break the stigma on each side in order to cultivate these connections. And so I wanted to say, create your own action steps to promote connection. I was going to give a list, but I think everyone in their own organization should create their own action steps to make connection. How are we going to do something different that has never been done before to change communities? And that's why the ROSC is so important, because what we will do is we will make connections with people. My mother brought others into this little house. And we had dinners together, and we played games. We couldn't go outside because she wouldn't let us. But the truth is that we had a good time in this little house that was really pretty bad. Okay, because you have to create that environment. And so doing something different, bringing in different cultures, connecting with different people, hearing people's stories, and taking the time will make a difference in you cultivating those connections. Recovery through connection is strengthening relations. This is my thing. Lasting change. Like, I remember names. I ask people in coffee shops. I ask people in libraries. I ask people their names. People's names make a difference. When's the last time you said, "How are you doing today? What's your name?" I always ask that question. Why? Because names mean that you actually care. And if I forget it in 5 minutes, I'm going to ask you again. "I'm so sorry, I forgot." But it's strengthening relationships to say that you care beyond your job. Okay, showing empathy and compassion, build a supportive environment. All of these things, celebrating small and big victories. I'm big on this. In every meeting I have, and every person I coach, counsel, no matter what, in every meeting, what are your biggest wins? Always ask people the victories before you ask them the challenge. Everybody should have some type of victory, okay? Especially in the area of recovery. If it's nothing but we showed up on Zoom today, you know what I mean? Be intentional about celebrating others rather than just celebrating your own wins, and stay consistent and present with people. That's building relationships. You know what I mean? And if you don't have the time to pull out your digital Rolodex, there's the referral hub. When's the last time you said thank you to someone, for like Danny and Jared and Blake, for running the referral ROSC hub? Thank you guys so much for that, because it is established relationship beyond the borders of my Will and Grundy County, right? What are you doing to make those connections? Okay. And here's my passion, you all: prevention for our next generation. So here's my thing: if we can't get it right, and if we don't share the stories, then how will they know? The next generations matter. Of course, I'm going to say through faith, because I love the Lord and I know He is sustaining our family through some very tough times, especially during the memories of the ones we've lost. But we have to support our young people by helping them feel valued and seen and understood. And how are we doing this at our ROSC? We're going into the schools. I have to say, we're going into youth groups, we're going into the churches, and we're saying, hey, and even libraries are partnering with us and saying, hey, can we put the flyers up here so that people can know? We have to build trust within families. Okay. We partner with Celebrate Families, and with the Illinois Family Resource Center, where we are hosting that program. And it is so crucial, and it is working very well, to teach families how to sit down together and have a meal together. We provide the meal, but we sit down with them and we provide them a meal. And then we have someone that has gone through the training to go ahead and create these safe spaces for families to know that although you're walking through recovery, you're not estranged to the world. I've got 2 minutes and 57 seconds. So let me hurry up. Encourage positive role models.
Neesha, I was gonna say you don't have to barrel through it.
I don't have to
Whatever.
barrel through it.
Listen,
Okay,
I love
okay.
hearing you talk. So
Okay.
take as much
I just
time
don't
as
want
you
to,
need.
I'm very time conscious of things.
Well, meeting ends at 4, so how about we'll give you
Okay.
that.
Okay, so I just wanted to mention that in terms of role models, I think about this all the time. What's his name? Dan Martin with the New Lenox Safety Coalition, which is in Will County. Your Light Still Shines is a big event where they come and we come together. There's a Narcan training. There's all these things, And I did make mention and I raised my hand in the coalition meeting. I said, hey, I want to volunteer. But when a young lady, 16 years old, walked up to my table, and she was probably the 1% of young people that were at this event, and said, my best friend overdosed in my room after school. And she said, and I know people, my parents don't really think that that would happen to somebody like one of my friends. And so I said, well, did you have Narcan? No. And when I explained to her about Narcan, it really made her go back and get her mom, bring her back to the table and say, we need to have this in our home. Well, here's the deal. We need voices from the next generation. And I asked that question yesterday in one of the presentations. I don't know if you remember, Jared. It's like, well, how can you get a youthful voice? Find out. And even if your children or grandchildren or sisters and brothers have never had an experience with substance use or mental health, it doesn't mean they can't champion for those who may. Like that young lady championed for her best friend who did not die, thank God. So here's my thing. What are we doing in our space with our family? Are we talking to them about what we're doing? Do they know? When we went to junior high school, the kids were like, no, I don't know. But the kids whose parents were EMTs or physicians, they had Narcan in their home. But majority of them didn't even have a clue. But then they all knew somebody that was vaping or smoking. So the thing is that we have to have a voice in order to provide prevention for our next generation. This is so crucial. We only see, I'm 55, unashamed, I'm grateful, but we see our age group and yet maybe 40s, okay? But who do we see that's in their 20s that may have, or 16 that has never, channeled through addiction, but needs to know what it takes to stay away from it? And you know what the stigma is? That if we introduce it, then they're going to start using. And that's not always the case. I know a lot of churches that we're partnering with don't want us there because you know why? They think that it's going to promote and introduce. No, it's going to prevent, to talk about it, to hear stories. Watching my family, my aunt, who's very close in age with me, walking the streets butt naked, okay, because angel dust and smoke, made me say, oh my God, I never want to do that. Okay, that's not everybody's journey. But then you also have parents that need encouragement to know that, hey, we need someone to talk to so that we can not, one of my godparents smoke weed with his son. So you see what I'm saying? Depending upon what's going on, positive role models. Only way we're going to do that is to build relationships. Okay. So change happens, by us learning to guide the next generation to healthy choices. And I wanted to leave the scripture is let us not give up meeting together. The scripture in King James Version says, do not forsake the assembling of yourselves together. And most church people, for lack of a better term, say, oh, that means you need to go to church. Well, no, that means we're assembling ourselves right here. This is crucial what we're doing. We're building relationships so we can change communities and provide hope for communities. I always say we're hope dealers. That's what we do. We're providing hope and prevention. Let us not give up meeting together as some of us are in the habit of doing, but let us encourage one another, and all more as you see the day approaching. And that's found in Hebrews. So show empathy and compassion, you guys. Build a supportive environment. Celebrate small and big. Oh, that's the last one. Okay. I wanted to just hit this a couple times. Be intentional about your community. Who are you partnering with? Even if you're partnering with DuPage ROSC, can you go outside DuPage ROSC and go and partner? Jared and DuPage ROSC is coming to ours in June during our ROSC meeting. So you all come show up and meet a different community. I have made so many connections just by coming. We provide love and grief care. We partner with Hero. They do the Narcan training for us. Next month, we will be in our Grundy County ROSC. We'll be in person, and actually Existential Counselors is sponsoring. That's the other thing. Sponsor your DuPage ROSC meeting and say, hey, we're going to meet at the donut shop there and provide donuts. ROSC can't pay for it, but somebody else may want to volunteer, right? So be intentional about supporting your community that's bringing change. And we have Dr. Kathleen Burke, who's going to be speaking, Dr. Sharma. These are our council meetings. this is our contact information. I know I said a whirlwind of stuff, you guys, but if I don't say anything else, I want to say that relationships were God's idea, and it is so crucial that we be intentional about establishing relationships that are long lasting in this space of recovery, but even beyond. I'll remember Jared for the rest of my life. You know, hopefully our funding will last. But the point is that the relationship should go beyond just your hands and just your touch. Okay. Thank you so much for today. I'm very grateful to talk to you all, and look forward to coming back again.
Everybody give Neesha a round of applause. I want to open it up for comments for a couple minutes. I will say this, and I've told you this before, Neesha. The work that you all do specifically, well, all the things you've been able to do are impressive, but what you've been able to do by putting together a family program and by taking those Circle of Care family trainings, I mean, you're head and shoulders above where a lot of ROSs are and some RCOs are, even with family related recovery work. I don't know if it's just in the air this month, but I'm hearing a lot of different family related things. I think it's a sign that I should focus on some of that myself for us. So very, very impressive. If anybody has a question or comment for Neesha about Heart Life or what the other things they may not have mentioned about the ROSC that's going on in Will and Grundy counties.
Let me just give some insight. The RCO, they opened a new RCO in Joliet, the RCCJ Recovery Community Center of Joliet. We were very intentional and partnering with them to make sure that that was up and running and off the ground. It's doing great things, providing showers. One of the things that is needed though is that transportation is a big thing in some of the more rural areas, right, to get to some of these places of recovery. So next month, Dr. Sharma, I mean, he's going to be there. They're opening an existential counselors over there in Morris, Illinois. So Joliet is like a main hub for a lot of spaces, but there's East Will County, there's North Will County, I mean, further South Will County. So there's so many more needs that are needed, you know what I mean, so many more recovery services that are needed. And so that's one good successful one, but there are several others doing it. We just have to push to try to get people, because a lot of people don't want them in the space and in the counties. I'm just not in my backyard is really, really big. And so we really have to work towards, that's where community and relationships come in. If I talk to them and take my banker a cup of coffee and say, hey, you know, thank you so much. Did you know this was going on? It'll stick out something. It's building those relationships that will allow people to know what's needed in the community.
Amen. Neesha, thank you so much. I usually share some of these materials and stuff when I send up a follow-up email. I'll send all your contact info, literature that you guys have. So thank you again for taking the time, and I look forward to being with you in June and seeing you every month. I see quite a bit, so I'm looking forward to that as well. We got a couple minutes left. If anybody has any program stuff they would like to promote, any upcoming meetings, any trainings, do you need assistance with anything? I'm going to kind of open it up, open the floor up for the last couple minutes. You can either raise your little digital hand, come off mute, or if it's somebody here in person, you can raise your hand and we'll put the game show mic around somewhere. I was going to psych you guys out. I'll be like, oh, wait a minute in silence if you want. I'm not going to do that to you. If you do have stuff to share, feel free to send it to me. I know I send y'all like kind of like newsletter stuff with all the things we're doing. Feel free to share that stuff with me. I post it on our Facebook group. I share that stuff in emails. Ben Rudolph, your hand is up. You want to send us off here, sir?
Hi, Jared. Thank you for letting me speak. And just wanted to say, you opened this meeting about what inspires you. And with these kind of icebreakers, I always feel a little flummoxed, like, oh my God, I don't know. And so I've been thinking about it. And really, I was at the statewide ROSC meeting yesterday also, and it was wonderful. And what's most inspiring are these groups. It's the democratic process. It's meeting with people who care more than I could ever imagine caring about other people. It's just, well, it's what Neesha was talking about, coming together with people. And it's a thing I say often, there's only one race. That's the human race. So we got to come together, man. And it's that togetherness and that thing that I feel sometimes with just regular people, we're all nothing special, but together we're something very special. So that's what inspires me. It's just talking with and being with other people who feel like I do, you know, we can work together and make this thing happen, man. Really, really inspiring meeting. Thank you for that.
Oh, thank you, Ben. Thank to everybody who came. Thank you to all the first timers. Feel free to come back, even the students. I know it's on the syllabus, but you can come back if you want. I won't tell Bruce anything. Just a last minute reminder, and I'll give you guys back your rest of your afternoon. Just a reminder that next Tuesday is the Help Teens Have a Summer to Remember event at the Addison Township. We would love to have you there from 7 to 8:30. The ROSC presentation series on vape shops is next Wednesday at 10. And last but not least, the next meeting of the DuPage ROSC Council featuring presentations by NAMI DuPage and Blue Kite Wellness is on Wednesday, May 14th. So we hope to see you at one or more of those. If you've got stuff you'd like me to share with my network, feel free to send it out to me and I'll make sure that I share that. Other than that, thank you, Neesha. I think Kylie had to jump off, but loved having you here and we'll see you all at the next one.
Thank you, everyone.
Thank you. Bye-bye.